Today, I wanted to go over a couple of things. Some interesting things came up over this week, and first of all, um, let's say what are we going to talk about. I think today, if time permits, I want to talk about asthma and allergies, but mostly asthma symptoms. Because in the last week, I had quite a few patients coming in with exacerbation of their asthma, probably because of various seasonal allergies. But asthmatics have, uh, relatively much harder time. Um, so that's what I would like to talk about. And secondly, I had some questions about hair loss, um, which is a very common question. A lot of people come in with questions about how can I stop hair loss, and it's a very worrisome condition for most people. Um, and so I just wanted to take a shallow review of that, more superficial. Don't want to go into many details, but at least we can touch the surface, and then in future, if needed, we can always go into more detail. Last week, I had a great opportunity to attend a lecture or a small seminar with some very prominent lung specialists in the area. Their chief of medicine, chief of pulmonology, and had the opportunity to meet with some of the other specialists in the North Jersey area and share some views on asthma. And we all agreed that right now, people are having more exacerbations. And more exacerbations means, they're coming into the office, or they're having more coughing and episodes of shortness of breath. They're having to use their inhalers. Albuterol is a very common name that pretty much everybody knows. We use it for adults and children alike, and it's a bronchodilator. That means it opens up the lungs and helps people breathe. So anyone who's had asthma is very familiar with that, and even some people who have some minor forms of asthma also have are familiar with this. So albuterol or their inhalers, it's usually red, but not necessarily. Some are blue, but people have heard the words albuterol, ProAir, Ventolin. So that's something that usually relates to asthma, although it is used for some other lung conditions as well. But lately, people have been using more of that. I've been getting more requests on refills, which is kind of a trigger for me to say, okay, maybe we should bring this person in. Why are they using their inhalers more, and they haven't requested a refill for many months, and suddenly they are calling to request a refill on that? And obviously, some are coming in and they're not feeling well. They say, I got a cold and I'm not doing too well. And or it's just that, oh, my allergies are worse this year than usual. So what I realized was that a lot of it is sometimes not having enough knowledge of what's really going on. And some people tend to have a slight cough, or they get short-winded very quickly. They blame it on their general health. Hey, I haven't been working out. I think I'm out of shape, and so that's why I've been getting short-winded. But the only difference is that they didn't gain 20 pounds in like 2 weeks. So suddenly they are getting more short of breath than usual. And the other thing is that a lot of people have uncontrolled asthma, so they've learned to live with that, and they think that's just normal. They tend to believe that that's how things are. I get short of breath, and I have to stop before I finish climbing the flight of stairs, and they're like, this is normal for me. And then so they just don't know what they could feel if they were breathing better. Um, and then obviously where it gets worse, that they have to come in, and then we examine, then we realize what they should be doing. So obviously I'm not going to tell you how to diagnose asthma yourself and what to do, but just remember, if you have ever been prescribed an inhaler, whether you have asthma or not, at some point, if you went to the emergency room, if you went to the urgent care center, your doctor, and they gave you an inhaler to use, uh, which is basically for the treatment of bronchospasm, is the term. That is, your lungs tend to tighten up. So if you've used that, and then you suddenly feeling a cough that's not going away, and you just don't feel well, a lot of tiredness, and a lot of cough at night, you're basically coughing nonstop, that is something you should get checked out, because some people have asthma, but some also have other forms of asthma, like seasonal asthma, sports-induced asthma, cold-induced asthma, exposure to certain allergens. Your neighbor got a new cat, and now suddenly you're the one who is having difficulty breathing. So that's causing asthma-like symptoms like bronchospasm and inflammation in the lungs, that is causing the tightness, or the air tubes to get tightened as a reaction to the trigger. So how do you know that you should go see your doctor? A simple way is why I brought up that if you've used that inhaler, if you've ever been prescribed that, and now you're having a cough that's not going away, or you're feeling short-winded, you should see the doctor. If you have an albuterol inhaler, and sometimes you use it a couple of times a year or during the season, if you're using it more than once a week, if you're having to use it, a couple of times a week or more, or if you're using it at night, or you're waking up at night, that you just have to sit up, and at night you just have to kind of sit up because the coughing won't let you sleep. These are the signs when you definitely should get checked, because with the stethoscope, your doctor can listen how bad things might be, if you are wheezing or not. Wheezing is basically the sound we hear when there's constriction in the lungs. Inflammation in the lungs, which is causing constriction, and the wheezing, it creates a certain kind of sound that we hear when the air is not moving properly, almost like wind instruments or flute. If the air is passing through a certain structure, it can make a certain kind of sound. Wheezing makes all sorts of sounds, usually not very musical, but definitely it creates a different kind of sound when it passes through that. And if your doctor hears wheezing, then you definitely need more treatment, not more albuterol. Albuterol is a rescue inhaler. It'll improve your breathing for a little bit of time, maybe for a couple of hours, maybe a few hours, 4 or 5 hours, but then you keep having to take it, and then it keeps you going, and you like that feeling because it opens things up. But if the idea is that if you're using it more frequently, then you should get checked, because you might need a different inhaler in addition to your rescue inhaler. It rescued you, but now you need something to keep you out of trouble. And there are various inhalers. There are 2 in the market right now that combine 3 different kinds of medications that help the lungs, and then they're very, very effective. One of them is taken twice a day, and the other one is taken once a day. But one is more of a powder form that you inhale it like that, and the other one is it just releases mist, and it lets you breathe. Different people have had different experiences with whether they like one over the other. Each one has its pros and cons, but either ways, they're both excellent, and your doctor should be able to go over more with you, and that will help calm down the symptoms. But also, your doctor might prescribe some pills or nebulizer treatments. So for that, you should go get checked out. And once you're on those other inhalers, you will start suddenly feeling better suddenly, and it's almost like a lot of weight has been taken off of your shoulders, and you can breathe better. Message is that if you see yourself using the rescue inhaler more frequently than once or twice a week, then it's a very good idea to go see a doctor, because there are medications available, treatment options available, and other educational other information that your doctor might give you that is more tailored to your needs, and it can be significantly life changing, or at least weeks changing until the season changes or whatever is causing your triggers goes away. And your doctor might do some testing for allergens and triggers to identify what is causing that, so you can actively avoid those triggers. If I've had a few people where they have new pets in the house, cats or dogs, and turns out they're allergic to cat dander or dog dander, and well, now they know. It's always a difficult situation when it's your pet that you're allergic to, but it's not uncommon. So I'll leave this at that, and your primary care physician is usually very well trained to identify and diagnose these conditions. And if you see a lung specialist, or they might refer you to one for further testing, depending on how bad things are, or how it should be managed in the long run. But definitely worth a visit to the doctor. Or they can just tell you it's not asthma, it's something else, and help clarify those issues for you. A quick overview on hair loss. We'll probably do a longer discussion on hair loss in the future, but one of our patients asked that I talk about hair loss a little bit. So here is a very simple understanding. So what happens usually is I get a lot of patients, especially women, who come in complaining of loss of hair, that, oh, I've been losing a lot of hair. I go into the shower and I pull out and I got a chunk of hair, or my hair is thinning. I'm losing a lot of hair. And with men, it's a little bit more obvious, like me. This is losing hair. Mine is a more of a natural hair loss pattern, male balding pattern. So at some point, this is all going to go. Hopefully, it'll take some time, but in women, it's more of a thinning of the hair. So one is where I'm going with this is that there's natural hair loss with age. When you have a male pattern baldness, some men will lose their hair even in their 20s, and some are losing in their 30s. But hair loss can start as early in their 20s. Mostly we see it starts in the 30s, and a lot of men, they just shave their full head just because they're sick of dealing with this baldness. But it's the way to understand is that although there are a few different ways, but men will lose hair in the front, and on the you'll see this hairline receding, and you'll see that this is keep going back, and then you start losing over here. The side, the hair on the side usually is spared, and in the back, so that will stay. Uh, and in women is just a generalized thinning. Again, mostly we see in the hair over here, but they'll lose. But it's rather even. And then in the other kind of hair loss is patches. You'll have a patch gone here, patch gone here, patch gone here, but that'll happen in all over the head. So you can have a patchy hair loss or a diffuse hair loss, and some occur with some scarring and some non-scarring hair loss. But that's certain details for the clinicians to identify. For my patients, it's very worrisome that loss of hair, and if it starts happening at a younger age, that can be very difficult to handle, as it has a lot of emotional effects on the person. So what we see is that if assuming that it's not a natural hair loss pattern, I've seen it very in a lot of people being genetic. If you look at your parents' pictures, especially your dad's, and if he started losing hair early and you're starting to see the same pattern, it can be a sign that, okay, it's just following a natural baldness pattern. But there's a lot of other things that can trigger these events, like certain medical conditions, thyroid conditions being one of big ones, and anemia, iron deficiency, other vitamin deficiencies, sometimes mineral deficiencies, like that we don't test for those, but microelements that might be missing, that can cause that. And actually, overdosing of vitamin A can sometimes trigger hair loss. So if people are taking too much vitamins, you can, too little or too much of anything is bad. So that can be there. But a couple of big ones are that you have less control over are stress, physical and mental stress. If people are dealing with physical stress is two things. If you got sick, we saw a lot of people with complaints of hair loss, especially women after COVID. This was it was a big deal, and it still is. But a lot of women had a lot of issues with hair falling and hair thinning. And after a while, we knew that this was due to COVID. But if you're sick because of anything else, any kind of illness that is there, whether it's a simple cold or some other infection that you had, and your body had to fight, hair growth can be disturbed. Fortunately, these things get better, and a lot of the women who were complaining of hair loss right after COVID actually did better. It took a few months, but their hair came back. So if you were hospitalized for something else, had surgery, and in younger women, childbirth, pregnancy, these hair loss can be a big one that you will see after these conditions. And hair loss, interestingly, it will not start right away when you're sick. It will probably start a few months after, a few weeks to a few months after something that happened, and that has to do with physiology and histology of how the details on how hair growth and hair loss works. So we all know that we grow new hair all the time and we lose hair all the time. I believe we have about 100,000 hair, but if you lose about 100 every day, that's a normal because you're also growing new hair all the time. And on the days that you shampoo, you tend to lose more hair. And if you're brushing your hair vigorously, you tend to lose more hair. And if the hair is weaker, then obviously you lose more. So basically, we're talking about natural pattern, patchy pattern that can be related to some scalp conditions, and then mental and physical stress. If you're going through a stress, a death in the family, or financial stress, or you're dealing with any other issues, you lose hair. My mom usually sometimes will say that you're gonna make me lose all my hair. So I never understood that, but I think it's that when they're stressed out about something, your hair loss increases. So just be aware of that. Talk to your doctor. Help your doctor identify and let them know that if you are dealing with certain stress, it helps them identify the cause of multiple illnesses. And if you're doing a crash diet every day, people are trying new diets. That will affect your hair growth or hair loss. So be aware of that. The other things that can affect hair loss and hair growth will be the chemicals and the hair products and the certain shampoos that we use. That's always that can make a big difference. Scalp health is also important. Too much of a dry scalp can cause that. Sometimes fungal infections, like sometimes simple things like dandruff that we see all the time, or other fungal infections in the scalp. Obviously, so if the scalp, the skin under the hair is not healthy, then the hair on that is not going to grow so well. So for that, we got to identify those problems. Then there are certain medications that patients take regularly for common conditions like blood pressure, etc. That can be affecting their hair growth. So if you noticed, obviously, if you've been taking a medicine for 10 years and you started losing hair 2 weeks ago, may not necessarily be the cause, but if you were started on a new medication and 6 months later you're like, my hair, I don't know what's going on with my hair. It can be due to it can be due to medications. So point being that, and by the way, natural hair loss is hormonal. So as the hormones change, these things can happen. But nonetheless, what are we going to do about it? You know, Hair loss is a concern. A lot of times men will just shave their hair and then they'll accept it that this is happening and this is normal. It's not going to alter their life, and they're okay with that. So it's an acceptance of their new look is one thing, but otherwise, if you're not ready for that, and or you want to prolong this period that you're not ready for it yet. So there are treatments for that. For a naturally occurring hair loss, that thinning, and it's related to whether it's hormones or it's just genetics. There are common medications like Rogaine and Propecia. These are the medication names are minoxidil and finasteride. These medications, the Rogaine, the minoxidil, it can be applied topically, so people apply it on their head, and it improves their hair growth. I've heard people try many other things. Some are saying castor oil, some are using else. But in general, more proven methods, yes, Propecia and Rogaine, minoxidil and finasteride. They work, and people do very well on that. For women, we use birth control pills can help, or a medicine called spironolactone. These are all medications that are actually for other purposes, designed for high blood pressure, etc., and for the prostate, but they tend to affect hair growth, and then they work. Bottom line, like, it's not gonna make you, the next Bollywood star, but it'll definitely slow down the progression and improve regrowth of hair. Uh, but the only caveat is, obviously some people will tolerate them better than the others. Some people will have some symptoms that your doctor can tell you about, or you can read the symptoms on the labels. But for the most part, people tend to tolerate these medications well, and then they work. The only problem is once you stop taking these medications, in about 4 to 6 months, all the hair that came due to these medications will start going away. So it's almost like you got to use that indefinitely, and it'll keep your hair. And if once you stop it, the benefits of that start going away. Then there are some other medications. There's another medication for the prostate that we use, dutasteride, but it's used off-label sometimes. It has been shown to be somewhat more effective than finasteride, but in my opinion, people have had they get good enough benefit from finasteride, that's Propecia, that they don't need to go any further than that. Now, obviously, there are other methods: a hair transplant, a platelet-rich plasma injection. These are reasonable options. Some are doing laser therapy. These are reasonable options, and there's no significantly known side effects to that. If that works for you, especially hair transplant, they take out the hair from the areas that are not affected by hormonal changes, and then just replant them here, and they tend to not go away. That is relatively successful. Some people do it, and it works out fairly well. These are costly, but definitely an option. If that's what you like, go for it. And usually these things work while your hair is still thinning. Once it's gone, then it's usually not that easy to bring it back. But when the process is happening, then it's usually better. And then obviously now these are just natural thinning, and assuming that now your vitamins, minerals, you're taking some extra. For vitamin deficiencies, I usually say that start taking a multivitamin over the counter. They tend to have a lot of minerals and micronutrients, etc. There's no one particular better, because these are not FDA approved, so you don't know which one is really better. Every fancy label doesn't mean it's better. I tend to rely on the usual common big brand names, because they have a bigger reputation to maintain. So they're likely you'll find what they say it's on it. But again, if you don't find that in those vitamins, then you can't blame them. They're not FDA regulated. But yes, taking multivitamins, improving your diet, improving fruits, vegetables, and more organic foods, that will help you. And taking a multivitamin, because if you're deficient in some manganese or zinc or certain other things, just taking multivitamin will cover that for you. Now, if let's say you're doing everything, you're not on a crazy diet or a crash diet, you're not working out, you're not going through certain stress, and you're having patchy hair loss, or there might be a different cause of that, whether it's autoimmune, whether it's bacterial, you have scalp infection, you have fungal infection of the scalp. So it's, there's other reasons, then seeing your doctor or a dermatologist. And there are other treatments where use of steroids is has been shown to be helpful, or treatment, obviously treatment of the underlying condition. If it's fungal, then antifungals. If it's bacterial, antibiotics will help. And then to stimulate growth, sometimes we use intralesional injections of steroids, and that's just you put steroids in the area, and that stimulates hair growth, and things start coming back. And Again, fair options. There are many doctors who are doing that, and that can be helpful. Goal is to identify where the problem is actually coming from, and what would be the best course of treatment rather than just trying everything. So, and avoid use of excessive hair products. Use better shampoos that are milder. I prefer to use baby shampoos because they're gentler on the skin. Don't shampoo your hair every single day. And Obviously, conditioners also. Don't use overuse conditioners, and don't leave them on for extended periods. Quick shower will help. And then Are there other medications? The only latest and the greatest what we have so far is this new medication called Olumiant. It's the first FDA approved treatment for baldness or hair loss. Olumiant, it's an autoimmune medication. It's also approved for rheumatoid arthritis, where your own body is making antibodies against joints. People will have, you've seen, in many older people where their joints the fingers will start deviating outside. That's a big sign of rheumatoid arthritis. And I specify that because here in the United States we use the term arthritis very frequently. But if people sometimes when they hear the term arthritis, they're thinking, "Oh my God, I have rheumatoid arthritis." But that's another for another day. But Olumiant is for rheumatoid arthritis and for alopecia, which is hair loss. It's taken as a tablet once a day. It has more side effects than the other treatments out there because it's an immune suppressant drug. It suppresses the immune system, which in a lot of people will reduce hair loss. But then if your immune system is down, then it comes with its own set of problems. But again, for today's discussion, it's an option. It has been FDA approved, and obviously it's very expensive, but something is new on the horizon. It just came out last year. We have not had much experience with that, probably just because of cost, and insurances are not going to cover it, and doctors are usually hesitant to try something new because they're not very familiar with the possible side effects. But similar drugs have been used for many years, so now we have a reasonable profile, side effect profile, and what to expect. So we're beginning to use these medications more and more as they become more available, or as they are being made more available by the insurance companies. So Lumiant is one. So I think hopefully this is helpful for people to understand hair loss and what they can do, what they should do, what they can't do. But obviously worth discussing with your doctor. Don't hesitate. But when you do see a doctor, tell them everything about your diets, about your exercises, about your stressors, because we find it hard to believe, but they do make a difference. And managing stress can help your hair too. So that's all I have. Thank you very much, and I shall see you next week. Thank you. Bye bye.